So now, for story number 2, let's go ahead and take it up a notch with a pediatric near drowning. So the story, you have a 6-year-old who was under the water for at least 20 minutes. To no surprise, the child is asystolic and cyanotic. EMS is en route to your ER at 300 miles an hour. So with that, if you only have an ETA of just a couple of minutes to get ready for a 6-year-old in full arrest, what size tube for a 6-year-old? Now, yes, you can do the formula if it's blown up 6 feet high, but again, we'll keep coming back to why do mental math if you don't need to. The little finger rule works, but you got to wait until the child is actually under your care. If you were to go ahead and take a look at cheat sheets, and you take your PD wheel and you dial in 6-year-old, because 6-year-old is remarkably close to 6-year-old, it'll tell you that a 6-year-old gets a 5.5 tube. If you were to measure this child, again, going head to heels, on Broselow, this child is going to be blue. And if we go ahead and we take Handtevy and we measure, this child is going to be blue as well. So with that, on the Broselow tape, again, epi on one side, endo tube and equipment on the other. If we take a look at a blue child on Broselow, it'll tell you that this child gets a 5.5 uncuffed. Otherwise, though, if we're using cuffed, again, going a little bit smaller, we get a 5. If you were to open your eBroselow app, just like the tape, it will tell you that you get a 5.5 uncuffed, or a little bit smaller, otherwise known as a 5 for cuffed. On Handtevy, if you take your book and you flip it to 6-year-old, it'll tell you that a 6-year-old gets a 5.5 cuffed. So now we've got to suck out the boogers, so you're like, all right, we've got that whole 2 times 3 times rule. So 2 times is NG suction Foley. So if this child has a 5.5, right, quick bit of mental math, 5.5 times 2 is 11. The problem is, when you try to find an 11 French suction, an 11 French NG, or an 11 French Foley, they don't make them. That's important, because they only make evens. Meaning, if you can't find an 11, what can you find is called a 10 or a 12, and either of which in a pinch would work just fine. And whatever you've got for an endo tube that's in place, tube and tape and 3 all begin with T, cluing you in that 3 times is where you tape it. Or if you forget the 2 time, 3 time formula, that's okay. If you were to look at the blue section on the Broselow tape for this child, it'll remind you under ET insertion length that this child's tube gets taped at 15.5 to 16.5. And when you're looking at suction, it says you get a 10 French. When it comes to NG, it says you get a 12 to 14 French. And if you're looking at Foley, it says 10 to 12. Again, it's all there, whether it's on the tape, or if you click to the eBroselow app, it'll give you the same pieces of information. Now, for Handtevy, remember, it calls ET size, otherwise known as ETT size. It calls suction catheter. And if you're trying to figure out where to tape it, they call it ETT at the lip. Now, whether it's in the book or as you're noticing hopefully a trend, you get the same information on your app as well. Now, IV is going to be anywhere, any size. Otherwise known as this child is IO. Because when it comes to children, just like adults in full arrest, more and more places continue to teach that unless you have an IV in already, don't bother. Just grab their bone, drill them, and be done. Because once you've got your IO in place, you can push your fluids, push your epi, and when they're a little bit more stable, then you can take your time and try to find something else. Now, how much should a 6-year-old ideally weigh? Because if you're in full arrest, we're certainly not putting you up on a scale. So a couple ways to figure that out. Number one, if you take your provided PD wheel and you dial in 6-year-old, it'll tell you a 6-year-old, 19, 21, 23, take the nice big number that's bolded in the middle, otherwise known as 21. If you were to look on Broselow, remember you have weight on one side, and you find blue, it says 19 to 22. If you look at Handtevy, it says 6-year-old ideal body weight is 22 kilos. So just to make life easy, if we call this kid 20 kilos, and we want to give fluid, we count fingers, count toes, and there hopefully should be 20. So quick bit of mental math, 20 times 20 means we give 400 of saline or ringers. And when it comes to meds, epi, whatever they weigh, just move the decimal point one time. So if this child weighs 20 kilos, we move the decimal point 1 point, and happily we just push 2 cc's of epi. So if you have to shock this kid, the easiest way I've ever come across to defibrillate a little kid is called pick up your paddles or pads and count them. Because if you pick up your paddles or pads, how many hopefully should there be? 2. And if there's anything but 2, put them down. A different professional should shock this kid. But if you can count, you can shock, because here in the United States, it's 2 joules per kilo the first time. And if that doesn't work, 2 times 2 hopefully continues to be 4. So it's 4 joules if you have to shock them after that. So if you forget how to count in the heat of battle, that's okay. Because other ways to remember it, number 1, if you take your Broselow tape and you find the blue section, it'll tell you that your first defibrillation attempt is at 40. Second one jumps to 80. If you take your Handtevy book and you flip down to where it says defibrillation, it'll tell you the first time's at 50 and the second time is at 85. And why those numbers are a little different in real life is simple, and that's called everybody says my defibrillator is better than your defibrillator. And it would be easy if people just said one simple amount, this is what we shock with. But with people saying my defibrillator is better than your defibrillator, they all tweak things just a little bit. But you know what? It'll get you in the right ballpark as to how much do you have to use to defibrillate a kid. And whether it's Broselow or if you've got Handtevy, if you click or flip, it'll show you how much to defibrillate with as well.